thank you, Lenny Bruce, for your immortal portrayal and depiction of Elizabeth Kubler-Ross's 5 stages of death and dying. Hi, I'm Dr. Renee Kohansky, and welcome to Episode 6 of Clinical Correlation. And in no particular order, those stages are anger, denial, bargaining, depression, and acceptance. Why, pray tell, you may ask, do I bring this up at this particular time and in this particular place? Between us. Well, let me float a pretty serious idea, and mind you, I have said this before. No matter the outcome of this recent election, 50% of our nation was going to be deeply grieving. And I'm not talking about upset, unhappy, don't worry, Tiger, we'll get them next time. I'm talking about the world as we know it is about to end kind of thing. It's practically impossible to miss that we've been building to a national, maybe even international crescendo. And what is different this time around, and what we need to know both as professionals and as fellow travelers, is that we are now in the information age, or some even say we are even in the drone age, versus previous eras such as the Stone Age, Bronze Age, Iron, Classical, Enlightenment, etc. In our information age, data is synthesized, transmitted, and even manipulated in competing ways so obscenely fast that it's impossible to know whether we are even to believe our own lying eyes. Why, sometimes I've believed as many as 6 impossible things before breakfast, claimed Lewis Carroll's Alice. In previous political arenas, our patients, and we, participated as if it were a spectator sport. We observed from the safety of our virtual television screen, where no actual human beings were harmed in the filming of that sport, except perhaps those on the political playing field. Now, however, our patients are no longer spectators. They experience themselves as an integral part of the teams on the playing field. There is nothing virtual about that. What's more, and I've said this as well in previous programs, there are 2 distinct realities being experienced. So necessarily, the outcome of this election must imply a personal loss. And because this loss is no longer an abstract loss of a political candidate or presidential candidate, this is nothing short of a death. Like, no kidding. And worsening this already volatile situation is that the veneer of civility that used to surround our political discourse seems to be eradicated. The days of yielding the floor to the gentlewoman from State Z seems to be some kind of halcyon dream. Y'all see what I did there, right? And instead of those kind, heated, passionate, sarcastic discourse between individuals with fully functioning frontal lobes, we seem to have reverted to typical mob dynamic, wherein those elected to essentially preserve our collective superego are encouraging behavior that would be appropriate for pre-operational thinking. We have to be careful not to be seduced ourselves. Our personal views don't matter one bit in any of this, not one little teeny tiny bit. We can support Biden, Harris, we can support anybody but Trump, we can love Trump, we can hate Trump. It truly, absolutely doesn't matter. Our sole function, despite anyone's agenda, remains true. And that is, and always will be, the well-being of our patients. So our job remains elegantly simple. We need to maintain a reality testing in a world that has seemingly, and I do mean seemingly, by the way, gone mad. And we need to help our patients through a period of what is in fact a true grieving period. Because whether ultimately Biden wins or Trump wins, certainly the ugly process of making the sausage has been unveiled, and it may have been there for all of eternity, and we perhaps would have been the better to have never seen it. I don't know. But once seen, it cannot be unseen. Though there is something to the histrionic who says, live life to its fullest and repress it. So we all together must negotiate this new, raw world together. I maintain this could be where we may be our greatest service, in not minimizing the loss, in recognizing that this experience of loss is no less than death. And here Kubler-Ross's words still hold true. The process, a process, not once and for all, but to be repeated until complete, right? That's what we do. A process until it's complete. And she totally got this death thing complete and utterly right. Anger, denial, bargaining, depression, acceptance. So let's be there with our patients and 50% of our nation as they go through this very important process of grieving in no particular order. Anger, denial, bargaining, depression, and yes, finally, acceptance. Because we have to get to acceptance of all things, like it or not. Life moves on. Maybe one more thing that I would say that's worth noting. As of the recording of this program, we are not even certain whose body is in the grave. So different times call to mind different images of our work. Right now, I'm thinking what we do is kind of like the movie City of Angels, where the angels are always watching, where they all gather at dawn to guide the souls to the next stage. And at this moment, I feel like we might be serving as guides, because whomever ultimately wins, we will be there, as we always are, right beside our patients, and maybe even besides each other, to venture to this next step. This was a bloody battle, and there may be a scorched earth. I'll end with a word of caution, and one that I've said many a time. Our greatest gift, our greatest contribution is truth. We must never allow ourselves not to be able to speak truth under any guise. I'm Dr. Renee Kohansky for Clinical Correlation.